everybody. Reporting to you again from the Glamour City, Hollywood.
Everybody's got to pivot to provide remote support. So, whether that's remote support to the individual, how can we, engage with the people that we speak to, give them information that they can use. And that's, for those that may not have a smartphone, there's the text capabilities that you can use. For those that do have smartphones, you engaging with the individuals themselves. And again, I'm thinking about some of the girls that we've been working with and having their own videos, talking about, well, here's how I'm coping with this. Here's information that you can use. Okay, here's how I can communicate back. They've got WhatsApp circles that are, self-supporting. And so, again, starting with that, the individual level, getting the right information, having access, including to, chat bots that might help a girl think through some of her reproductive choices and where she might go if she wants reproductive care. And that happened quickly, but it was quite impactful. And then all the way up to, again, health providers. And so, how might we leverage digital technology from an e-learning perspective to quickly upskill providers at different levels with information that they may need.
If you love listening to this show, please consider giving a rating and a review on Amazon Alexa or wherever you listen. We want to continue bringing you this amazing content, and part of our ability to do that means that we need a big audience. Now, it may not seem like much, but rating and reviewing the show will help more people find us, just like how you found this show. Simply on any podcast platform, search for a show, scroll down to the bottom, and push 5 stars. It's that easy. Thanks for supporting the show. Today, I'm joined by Alison Malmqvist, Director of Sexual and Reproductive Health, Climate Health Lead at PSI Global. Welcome to the show today.
Thank you so much for having me. It's a delight to be here.
You have worked in South Sudan, DRC, Kenya, and the Caribbean, to name a few. I wonder, in the last couple of decades, what have you seen in terms of climate change and its impact on some of the local indigenous people, in particular, women and girls?
Thank you so much for the opportunity. I have had the honor and the pleasure of working around the world globally. And I think, over the past 20, 25 years, and even sort of in a more accelerated pace, seeing communities impacted more by climate-related events. So floods, we've seen, cyclones and things coming through places like Malawi, faster, many, many more communities having to cope. Things that were maybe once every couple of years emergencies are happening not only annually, but they're happening multiple times throughout a year. And so populations are moving. They have less ability and access to just go to sort of primary care facilities for routine health services. If they're impacted over and over by a flood event, a landslide, something, if again, we have more precipitation, less precipitation, that can also mean drought events, and people have to move in order to find the resources that they need. All of that is accelerating. It's moving faster. When we started to talk about climate and health a couple of years ago within the organization, I reached out to a lot of our global leadership in places like Ethiopia and Mozambique and said, do you think climate change is going to be a problem for us and the way that we're thinking about engaging in public health, in the future? And every single one of my leaders said, what are you talking about? It's here. We're working with girls, helping them with sexual and reproductive health. And they're saying, this is great. I want to have access to these things, but I'm also looking ahead and I just don't know what my life's going to look like. And that's as true where I live, in the United States, as for a girl who may be 17, 18-year-old living in Malawi and sort of looking out and saying, what does my future look like? It looks really complicated. And so, we have an opportunity now to start to think about that more proactively rather than reactively. And that's the big challenge for us right now.
Yeah, I think on this podcast, we've had a number of many interesting experts that have come on over the years, and we've examined the many different facets that climate change affects, everything from health, food insecurity, migration, to even violence and crime, for instance. And certainly it is quickening in terms of the pace and acceleration of it. If you could talk about the impact specifically to women and girls in the sense of why are they even more vulnerable to, let's say, the kind of larger set of population within some of these regions?
Yep. Thank you for that. I think women and girls are more vulnerable in two ways, large ways. One of those is biologically. Girls, children can be more susceptible to the effects of infectious disease transmission. Pregnant women, in particular, very vulnerable to the impact of heat, but also vulnerable to, again, infectious disease transmission. If we're seeing increased transmission of things like malaria, things like dengue, women during pregnancy are vulnerable. They are more vulnerable. Their unborn child is more vulnerable to those impacts. So there is a biological vulnerability, but there's also a vulnerability in terms of sort of inequitable power dynamics and women and girls' agency overall, the decisions they're able to make, action they're able to take. We know that when populations are impacted and need to move, and you have people migrating and moving, often a significant percentage of that is girls and women. They are vulnerable to things like increased gender-based violence. We saw this happen during the COVID-19 pandemic, and we see this happen again when there are, humanitarian emergencies, which increasingly now have a climate element to them. And so, again, they are more vulnerable, but they're also, in many ways, our best resources if we're thinking about, capacity to adapt and capacity to take action and think about, again, proactively what solutions could look like, because they're so engaged as, caretakers. They are breadwinners, they are advocates, they're leaders in their own right. I mean, if you really want to know what's happening in a community, ask a woman, ask your teenage daughter what's really going on, and often will give you this wonderful insight in terms of, here's what's happening, here are the needs. If given the space and the support and the voice to talk about those things, they have a lot to say and a lot to offer. So, in our work, we engage with them from a health perspective, but increasingly, and again, in response to what we're seeing and in response to what girls are telling us, it's not enough to just talk about how might we help you take care of your physical health, but also your mental health, and create opportunities for you in the future, dignified work, education for yourself, education for your children. How do we think about you holistically and work with you holistically so that you're not just sort of surviving everything that's happening, but potentially thriving, and see this as an opportunity.
I think you made some excellent points, and certainly the last point that you just made around this notion. When we talk about global health, it's not just the physical welfare, but it's all that holistic needs of those individuals. So I really do appreciate that. One of the arguments that I believe you make is that the global health you're suggesting is potentially missing from the climate change agenda. And I wonder how, well, first of all, what does that really mean, and how does that work in the context of something like the Alliance for Transformative Action on Climate and Health that I believe is part of, somehow related to COP26, for instance?
So it's a great question, and I would say, I hesitate to say late, because late suggests that the health community has not been paying attention, or it's too late to take any kind of action. But I think there is a recognition that health hasn't been really part of a dialogue that's been happening in an organized and in a focused way until really recently. And the first time health was on the agenda formally with the climate conversation. So the Conference of the Parties, COP28. It was a huge step forward to have a day that was dedicated to health. My word of caution to the health community was, this is great and it's a beginning, but let's recognize that there's been a dialogue and a conversation about climate happening more than 30 years plus, lots of individuals, lots of organizations already engaged. And so I think helpful that we're now part of that dialogue, although still not quite central. I do think that there has been a bit of a shift. The COVID-19 pandemic, and I think I'm always an optimist looking for a silver lining, but I think it did sort of expose all of us to the fragility and the vulnerability of humans as a species, as occupying this planet, and at the same time giving people who hadn't perhaps previously thought about it some language to talk about what happens when we're all vulnerable in this way, and what do we need to have in place to avoid this thing happen again. And I as that dialogue is happening and those conversations are happening, we're seeing heat waves coming through Europe. We see, again, as I mentioned, cyclones and things happening in parts of Africa that we just haven't seen in a long time and at a frequency we've not seen before. And so it's sort of opened up this space to have a conversation about health, and health is really the humanization of what's happening to the climate, and the sort of interrelated connection between planetary health and things that are happening to the planet, and sometimes direct and indirect impacts that's having on health. At the end of the day, the impacts of climate change will impact us as well, and bringing that into the conversation can add some urgency, and can support some of the sort of community and individual level action that needs to happen, because it's personalized in that way.
Absolutely agree with that. I wonder if we can go down a little bit, one level deeper, and specifically some of the areas that I think your organization talks about. You mentioned earlier about malaria, and how, if you could just talk about how malaria is changing in terms of both the transmission, but also the types of preventive things like bed nets, why that's not sufficient anymore.
So it's a great question, and that's one of the I've had the pleasure of working within the malaria community, malaria space for more than 20 years, and huge progress being made. So malaria treatment regimens that work well, preventive technology, long-lasting insecticide-treated bed nets that people can sleep under and be protected. Getting on top of sort of, with better and better data, technology innovation that allows us to collect data in more and more localized places, send that data up, have, timely surveillance data, things we can act on. All of those things and more have allowed us to make huge advances. If we're having changing climate patterns, if we're having places experience higher temperature fluctuations that haven't before, you've got a longer season of transmission. And so a malaria that may have only had a short transmission season because it's simply, temperatures drop, the mosquitoes don't thrive, you get a bit of a break, and then they cycle in, and you can kind of prepare for that and prepare communities for that. Those seasons either become longer or the seasonality disappears altogether. And so that disrupts some of the planning that happens, and the preparedness of the populations. If some of our treatment is becoming less affected, and we have communities who may not have been as exposed previously, your risk of severe morbidity, illness, and death associated with that goes up. And so, we, along with the rest of the malaria community, are saying, look, we've made this progress. Patterns are changing. Vectors, their behaviors are changing. Mosquitoes that are biting at night start biting during the day. That's, you're no longer, sufficiently covered if you're just sleeping under a bed net at night. Communication has to change. And it's a lot. We've also, I was surprised at the, is it a resurgence? Dengue is now sort of back in the conversation. And, it's a serious illness. It's one that has been present in a lot of communities for a long time, but suddenly the level of resurgence, I think, has surprised a lot of people in the infectious disease community, and sort of sparked some conversations about what does community level surveillance look like. And that's something we're particularly interested in. We work across health sectors, and so we're engaging with communities in different ways and asking questions about, can we work with grassroots organizations, with communities, so that they can capture data, capture information? Is there an increase in fevers? Is something potentially happening? Are more people coming into a local clinic? Can we get that information? Can we have a look at sort of weather patterns and think about trends that may be happening? Does that help us with our planning so that we're getting the right sort of treatment, the right preventive tools in the right places at the right time, and sort of rebuilding a kind of response that starts with communities who know what's happening on the ground, providing that kind of information, planning happening, at the higher levels, and then information and support going back sort of down the chain. So facilitating a sort of two-way conversation, two-way preparedness. We've also discovered, in this journey, that some of the disaster response preparedness and planning isn't necessarily taking into account what's happening with people's health on the ground. So, what do I mean by that? You'll have sort of disaster response planning happening that's looking at things like weather data, and that's sitting with, ministries that oversee weather data and weather information. That doesn't necessarily take into consideration preparedness and planning for what may happen from a health perspective. What would infectious disease, what infectious diseases are we anticipating? How might we make sure that, health facilities in those areas have what they need in the event that there is an increase in waterborne disease, diarrheal disease? Do we have the things that we need there? And access to clean water from a health perspective. So we're trying to kind of break down some of those silos so that we're bringing the health element into preparedness planning, and again, getting ahead of it and making sure then that the right level of healthcare worker has the information that they need, they have the tools that they need, they have the support that they need, in order to offer care when those things do occur. Whether it's again, with malaria, it may be, increasing frequency or a longer transmission season, or it could be, again, there is an unanticipated storm that causes flooding, that either, disrupts access to care or sort of facilitates transmission of waterborne disease, and making sure that those individuals have that access. It's a lot.
Yeah, you bring up an excellent point around this notion of planning and taking account data from, for example, satellite, but also other types of Internet of Things, and even their mobility, as most Africans and Caribbeans will probably likely have some sort of phones. So all of these provide sensor capabilities and data. But to your point, perhaps maybe there's being economic and financial modeling happening, but it's not getting cascaded down at the health level and the implications, whether it's infectious diseases or, the next topic that I want to talk about is sanitation, because when you have an overflow, that impacts, water tables, right? And how does climate affect sanitation, and what's being done to help prevent and mitigate some of these environmental impacts?
That's a great question. And, we've had an opportunity to engage, we're part of a sanitation coalition that's thinking about, what do we mean by climate resilient sanitation? What does that look like? And some of the vulnerabilities. So again, you have infrastructure vulnerabilities in terms of, in a lot of places, the only access people may have to sanitation is a pit latrine. If that pit latrine isn't fabricated and maintained with resilient materials, there can be flooding. When there is flooding that happens, again, you can get fecal contamination that happens, and that moves into the community. So there's a disease transmission element to that, but then there's also just the absence of sanitation, and you're going back now to an open defecation situation. Again, it's not, it's detrimental to dignity, and also just in practical terms, people just don't have access to the kind of sanitation facilities that they need. A lot of the sanitation conversations to date, and a lot of the water elements of that as well, have been thinking about big municipal sanitation and urban sanitation and hardening that infrastructure. Within PSI, again, we're working kind of at the community level and saying, all right, the reality for a lot of people is, something that's going to be built by a local mason using materials for a pit type latrine. How do we train local masons, local builders, using better resilient materials that can, withstand the impact of this kind of an event? How do we make sure that, again, you've got to manage those. There's a fecal sludge management element to this. If you're, again, suffering from a flood, how do we make sure that those sanitation facilities are themselves being tended to and cleaned and maintained in that way? So what does that supply chain look like? So part of our work is again, working with the local community, working with, in many ways, sort of a local dynamic private sector to say what's available, who's trained, are you using the right materials? When those things are put into place, do you have access to the services that you need? And then how do we harden those services so that they're less impacted when there's an event? But it is, I would say, a work in progress. I don't know that I wish that there was one solution. I think what I'm understanding is you pull on one thread and then there's something else that you need to think about. So, okay, we've got great materials. Good. Let's train. Let's get those great materials. Okay, well now the trucks can't move. So, how do we then offer services so that we're desludging and doing those things? So it's a lot.
It is indeed. We just briefly talked about the fact that most of these indigenous people in these regions are probably equipped with some sort of a smartphones to an extent.
Yep.
And the reason that's important is there's a lot more capabilities that's becoming native to these phones, including ability for diagnostics that uses computer vision, to all sorts of different sensor capabilities within the phones. Can you talk about how the mobility aspect helps enable self-care practices as well as home kits and other self-diagnostic types of solutions?
Absolutely. And I think we are excited about, how do we harness this? And again, lessons from COVID-19, everybody's got to pivot to provide remote support. So, whether that's remote support to the individual, how can we, engage with the people that we speak to, give them information that they can use. And that's, for those that may not have a smartphone, there's the text capabilities that you can use. For those that do have smartphones, you engaging with the individuals themselves. And again, I'm thinking about some of the girls that we've been working with and having their own videos talking about, well, here's how I'm coping with this. Here's information that you can use. Okay, here's how I can communicate back. They've got WhatsApp circles that are, self-supporting. And so, again, starting with that, the individual level, getting the right information, having access, including to, chat bots that might help a girl think through some of her reproductive choices and where she might go if she wants reproductive care. And that happened quickly, but it was quite impactful. And then all the way up to, again, health providers. And so, how might we leverage digital technology from an e-learning perspective to quickly upskill providers at different levels with information that they may need. We think there's going to be a heat event. Okay, there are modules for providers at different levels about how to address heat-related vulnerability, again, around pregnant women. And so is there a way that we can leverage that kind of technology to reach out to a network of midwives and say, look, heat-related event is happening. We can see it. We can anticipate it. We know this is coming. Let us get to you, whether it's video or whether it's by text, the kinds of information that you need. Can we connect you maybe into a WhatsApp chat of some sort so that you can support each other and we can support you quickly and in real time as things happen? Provides both the frontline health workers and those of us supporting the frontline health workers with more flexibility in terms of how we do that. Part of that, though, and I'm thinking of also from a regulatory environment, but also an enabling environment, sort of connecting those frontline health workers into the system. Often they are not recognized as part of the health system. And data and information that they may collect, again, using a smartphone. The people working at the community level are closest to what's happening. They've got really important information that they can capture, but they need to be validated as professionals and as a meaningful part of this kind of ecosystem of information exchange, so that what they are capturing is passed back up through so that there can be good decision making, and then that information can flow all the way back. So we talk about the potential of digital at those different levels, but there also needs to be a sort of recognition and validation of people at those different levels. But it does open up quite a lot. And things like telemedicine are very exciting. We grapple with how do you make sure that the quality of care being provided through these different kinds of digitally enabled solutions is maintained, because the care that you're receiving, it's only as good as the quality that's sort of guaranteed behind that care. And it's just some of the conversations we're having internally about how do we make sure that happens as well.
Mm-hmm. You bring up an excellent point about frontline workers, because some of them are not salary, they're volunteers, and in some cases they're the actual women and the girls that are part of the constituency as well. And to that point, it's very important for solutions to be not externally created and then enforced, but rather it's co-designed. Can you talk about how do we empower the very people, the very women and girls, in such a way that they feel that they're part of the health solution process?
I appreciate that. And as you said, we're talking a lot about transforming healthcare, and I think organizationally, personally, my first experience working in public health was in a tiny clinic in a very remote part of Mali, and working hand in hand with those frontline health workers. And they are often volunteers. And I think some of the transformation within the health system that needs to happen is finding ways to give them the financial resources that they deserve and merit and require to do the work that they do. In terms of part of that recognition and validation, and that's something I think is beholden on us as an organization, is to make sure that they are brought into the room and given the space. This is not brainstorming and decision making that's happening in some office in Washington, but really sitting with them and saying, here's the challenge. How is it impacting you? What are you thinking about it? What are you seeing? Listening carefully to that, especially with girls and women as well, being sensitive to the dynamics in the room. And I go back to power dynamics and, sensing if and when there may not be that space to speak openly and freely, and making sure that we're attentive to that. And that means, how we construct and configure the groups as they're being put together. And then continuing not just to work with them at the beginning of that co-creation process, but throughout. So how do we work in partnership so that we co-create something, we're creative about how we approach the problem, come up with some solutions. So let's prototype those the way that you would a product. Let's prototype an approach. Does this set of instructional materials around how you might address, again, I'll go back to pregnant women coming in because there's a heat event happening. Does that work? Are you getting good feedback? Are you feeling like this is supporting you in the work that you're doing? If not, let's redesign. Let's go back and let's talk about that. And it's an iterative process as we're going through, and then it's creating mechanisms so that we're getting feedback from the users of some of these tools, whether it's digital, whether it's paper, whether it's an approach or information, but then also the clients and those who might be, again, thinking about health, receiving a service. Did this help you? Was this useful to you? Were you treated with dignity? Were you treated with respect? And feeding that into this kind of iterative way of working is the way that we're working, and we are in dialogue with our funders and things. It is a great way to work. We're often not evaluated in that way, and so it's sort of like, this is the answer. This is what you're trying to achieve. This is the anticipated pathway, and you're sort of evaluated against that. These pathways are not going to be as straightforward, and working in these iterative ways will also require us, just as a global community of practice, to be a bit more flexible in timelines and what we think about in terms of what success looks like, because it may not be a straight line from one thing to another. It may be a bit of a winding path, but that is what locally led solutions require. And that's the way that we should be working if we're really going to be serious about things that are appropriate and sustainable in the long term.
Yeah, makes perfect sense. So we have just one more minute remaining.
Sure.
What is your final message, if you could communicate to the climate organizations that are out there? What would you tell them about global health?
I think, there's sort of two things. One is, we operate in the same communities. And, as I mentioned, there's a lot of, climate-oriented organizations and grassroots organizations. I've had the pleasure of meeting with them and working with them now more. And at the end of the day, we're working in the same communities and we care about the same people. And we've got a shared value in helping those communities, again, not just survive, but really thrive. And so, people aren't looking at us from a vertical sector perspective. They're living their lives and they want to thrive. And so how do we come together to enable that? I would also say, again, it's not just helping people survive and thrive, but, at all of the climate action, the climate solutions are going to require people. They're driven by people, and people's ability to engage, be part of solutions, be part of change is going to be dependent and powered by their own health and well-being. And so, there is a fundamental nature to health and well-being that is going to be required through health investments so that people will have the capacity and the ability to engage in effective climate interventions and action in the future. So we're partners in this.
Terrific. So with that, I have been joined by Alison Malmqvist, Director of Sexual and Reproductive Health, Climate Health Lead at PSI Global. Thank you for joining today.
Thank you so much for the opportunity. I appreciate it.
If you've enjoyed this episode, take a moment to rate our show on any podcast platform that you listen to. Scroll down to the bottom and push 5 stars. It's that easy. And as always, thanks for listening.